So our first speaker is Dr. Brennan McKenzie. Brennan is a small animal practitioner receiving his veterinary degree from the University of Pennsylvania and an MSc in epidemiology from the London School of Hygiene and Tropical Medicine. His main interests lie in soft tissue surgery, evidence-based medicine, emergency and critical care, and the biology of aging. So in 2009, he launched a blog called SkeptVet, promoting science-based medical interventions for companion animals and discouraging unproven approaches after he encountered numerous questions from clients about therapies for which he found high-quality clinical research was sparse or non-existent. This led him to receiving the 2022 VIN Veritas Award for Science Communication. He is past president of the Evidence-Based Veterinary Medicine Association and author of the book Placebos for Pets, The Truth About Alternative Medicine for Animals, also published in 2022. He is currently director of veterinary medicine at Loyal, a biotechnology company working to develop medicines to extend the healthy lifespan in dogs.
Thank you, and thank everyone for coming. This is, I think we were discussing just before we started that this is a very moving topic for a lot of people, lots of excitement and interest in it, and maybe some controversy as well. So I hope that between Nicola and I will help you in understanding how you want to approach this with your clients. And I've taken the approach of considering this in terms of shared decision making, because we have a role to play and our clients have a role to play in making decisions about neutering. And so I want to explore those roles a little bit. I'll start by just kind of giving you an intro to my perspective, my biases, if you will. As mentioned, I'm a general practitioner. I've been in small animal general practice for about 25 years. So these are conversations I've had on a daily basis for a very long time. And my own approach has shifted over the years. As also mentioned, I'm really interested in evidence-based medicine. I'm kind of a nerd. I like to think about how do we take science and turn it into practical recommendations for what we do in the clinic. So I have that background, and I'm going to bring a little of that perspective to this. And then, as mentioned, I fancy myself something of a science communicator. I'm really interested in talking to people about science who maybe aren't scientists and maybe have a slightly different perspective than we as veterinary professionals do. So shared decision-making, I think there are two components to this when we're talking about neutering. The first is, what do we want to say? How do we look at the science and understand what it means and then make up our own mind about what recommendations we want to offer? And then secondly, how do we do that? How do we communicate those recommendations to our clients? What do we want to say about neutering in a way that helps to shape their decisions and inform their decisions and supports the welfare of our patients? So we'll start with kind of the scientific side of things. Looking at it as a scientific problem, what do we know about neutering and how does that inform the recommendations that we offer? I think beyond anything else, we all have to accept that biology is really complicated. And this is an area where there are lots and lots of variables at play. We are not going to find a single simple answer to the question of what and when we should be doing these procedures. There are factors like the sex of the animal, the breed, the size, body weight in terms of obesity and overweight, diet, activity, so many factors that all interact with one another to influence the ultimate clinical outcome for each and every individual patient. So the idea that there is going to be a simple, universal, and eternal answer to what should I do is one that we need to let go of if we're going to make rational evidence-based decisions in this space. So I wanted to take some data from a paper that I just did on risk factors for osteoarthritis in dogs and show you sort of the way in which different factors can play into the ultimate clinical outcome. And we're going to see how that then affects our interpretation of the massive, massive database around neutering. There are hundreds and hundreds and hundreds of journal articles and lots of variables that have been examined. So if we're thinking about something like osteoarthritis, what are some of the variables that come into play? What we discovered in our research, looking at a population of tens of thousands of animals, is that obviously this is an age-related disease, so age was a significant factor. The survival curves here are just a way of showing which groups are most susceptible to developing this particular condition. So those who are older are much more likely to develop osteoarthritis than those who are younger. Nothing super surprising there. Is sex a factor? This is something we looked at because this is often a question that's asked in terms of risk factors for medical outcomes. And we found that it was not a meaningful factor. There's not a big difference in the risk of osteoarthritis between males and females, but it was statistically significant. And I bring that up because that comes into play when we start looking at risk factors for arthritis. The difference between what is clinically meaningful and what is statistically significant is a pretty big difference sometimes, and we have to bear that in mind. Body size obviously plays a factor. So larger animals are more likely to get osteoarthritis than small animals, and so does weight gain. So here's a little chart just showing that those individuals who gain significant weight after maturity are more likely to develop osteoarthritis than those who don't. But if you look at body condition scoring, which is how most of us in clinical practice would approach deciding whether an animal is overweight or not, that was again statistically significant, but not really a meaningful difference. And that shows us that sometimes making judgments about these things depends on the tools we use. It turns out that the body condition scoring tool that we used wasn't a very effective one, that veterinarians were just lumping dogs into normal or overweight and not using the full range. And so we didn't get to see a separation here. Those kinds of things affect how we look at the many, many risk factors for neutering as well. And there were lots of interactions. And whenever we look at a complicated biological question, we have to think about interactions. So I showed you earlier that bigger dogs are more prone to osteoarthritis and that gaining weight is a factor for risk for this. But it turns out that gaining weight is mostly a factor in larger dogs rather than in smaller dogs. So the pre-existing baseline risk is going to turn out to be really important. And that's a feature with neutering as well. And then obviously, because we're talking about neutering, let's ask, is that a risk factor for osteoarthritis? And the answer is yes. It turns out that one of the many conditions that's influenced by neutering is osteoarthritis, and that the risk is greater in neutered or desexed animals than in intact animals. The hazard ratio here was just a little under 1.4, which loosely speaking, we can say is about a 40% increase in the risk. Now, the age at neutering is another question that comes up often. And with regard to this particular condition, as an example, osteoarthritis, it turns out that age at neutering does have an influence on the risk factor of osteoarthritis development. So in this case, if the dogs were neutered at less than 6 months of age, that was kind of considered the baseline. Dogs who were neutered over 6 months of age had about a 13% reduction in risk, which is small but significant. If we waited until a year or 2 years, so between 1 and 2 years, there was about a 28% difference in risk. So less risk the longer we wait to neuter. And then if you go beyond about 2 years, in this particular study, there wasn't much difference. So there was about a 32% decrease for dogs neutered after 2 years. So something happens right around 1 to 2 years of age, and I think we all know what that is, which is full skeletal maturity, or the end of the growth period. And that's a risk factor in this case for osteoarthritis. So often the evidence is unclear. And it's difficult to do studies like this. We cannot take 10,000 dogs and randomize them into neutered and not neutered and follow them for their entire lifetime, which is what we would ideally like to do to get, as definitive an answer to this as we possibly can. There are lots of confounders, the size, the sex, the breed, all of the other factors that I talked about. And sometimes the results of individual studies are not always applicable to the patient that you have in front of you. If I'm looking at a research literature that entirely consists of golden and Labrador retrievers, and I'm looking at a beagle, is that even applicable? Oftentimes that's not, and that complicates the scientific approach to something like neutering. It can also be kind of difficult for us to interpret the results of the literature studies. And sometimes if we don't necessarily know what the difference is between an odds ratio or a hazard ratio, we may read a study and not come away with really the right picture. So the way I like to think about evidence as a way of informing clinical practice is that the evidence creates a picture, right? And the more detailed that picture is, the easier it is to focus on one factor. So if we're looking at neutering and we want to know how does neutering affect the risk of hemangiosarcoma, for example, we can zoom in on that one particular factor. And if the evidence is clear and consistent, we get a more detailed picture. Unfortunately, that's not really the case in this situation. Neutering, for the most part, has an evidence base which is enormous and complicated and fuzzy. It doesn't create a particularly clear picture. And if we zoom in on one subset of that, we don't necessarily end up with additional clarity. And that's all a way of saying that we need to be mindful that this is a complicated subject and the answers that we get have to be nuanced and reflect that uncertainty and that complexity. Now, I want to take a quick second to talk about the difference between absolute risk and relative risk. And the reason I'm doing this is because This comes up all the time when clients will hear something online about neutering. Oh, neutering increases the risk of cancer or increases the risk of orthopedic disease. And oftentimes the way we talk about risk isn't very clear, and that creates false impressions. So this is some data from a study that looked at a large number of animals and the risk of cardiac tumors associated with being intact or being desexed. And in this study, there was a 338% increase in the risk of heart tumors in dogs, in female dogs who were spayed compared to female dogs who were intact. So 338% is a pretty enormous risk difference. And that can be quite scary and may make us immediately go, maybe we shouldn't be doing this procedure. So let's look at some of the nuances or the details. One breed that was looked at in this study were Rottweilers. Now, they have a baseline risk of about 0.09%. So roughly 1 in 1,000 of these dogs are going to get, intact female dogs are going to get heart tumors. If we spay those dogs and we increase that risk by 338%, we're looking at an increased risk of about 0.3%. So by neutering, we've increased the risk of this something around 2 extra tumors per 1,000 dogs. Now, that's a relatively small absolute risk difference, despite the very large relative risk difference. How should we figure that into our decision making? How do we balance that against the risks we may be lowering by spaying these dogs? This is why it's important to think about absolute risk differences. Now, if you're looking at an entirely different breed, like golden retrievers, they have a much higher baseline risk. Their baseline risk is 0.65%. It's already twice what it is even at the elevated level for the Rottweilers. If we then spay these dogs, we increase that by 338%. So we get a risk of about 2.2%. So now neutering is potentially creating an additional 10 tumors per 1,000 dogs. Still a relatively small absolute risk, but bigger and maybe factoring more significantly in our decision making. They also had about 5,000 Pomeranians in this study. Their baseline risk was 0, and 338% of 0 is 0. So we didn't have any effect at all on the risk of heart tumors in this breed. So this, again, is just a way of saying when you hear a figure from a study that says we increase the risk by X%, we have to think about what the baseline risk already is. And the higher that is, the more meaningful the increase in risk is likely to be. Research is also tricky. Sometimes we get answers that aren't actually reliable. This is a study that was conducted in 1969, and I don't know what the situation is wherever you are in the rest of the world, but here in the US, every vet student that I've trained or seen in the last 25 years has been required to memorize these numbers, that if you spay a female before the first heat, you have a 0.5% risk of mammary cancer. That goes up to 8% after the first heat and 26% after the third. And those are pretty significant relative risk numbers, and they've led a lot of people to feel very strongly that this is by itself sufficient reason to recommend universal spaying before the first estrus. But a systematic review looking at all of the literature around the question of mammary cancer and neutering in female dogs graded the quality of evidence of all of the studies they looked at. And this particular study got a grade of D on an A to D scale. So this is actually very poor quality evidence. Now, that doesn't mean that there's no relationship between, for example, spaying and mammary cancer. The systematic review found that there probably is a relationship, and that, in fact, earlier spaying may be more beneficial in terms of preventing mammary tumors. But the key point here is that those numbers are not reliable. They come from fairly low quality evidence. And if we quote those numbers to owners, for example, we're going to give them a false sense of certainty and of accuracy in our recommendations. So we have to be mindful that the research can be quite tricky and difficult to interpret. So what's the bottom line? Or for those of you who are millennial and younger, what's the TLDR on this subject? Neutering influences risk at a population level. It doesn't make things happen or prevent things from happening in a lot of cases. There are a few in which it does, but it shifts the balance of risks in general on a population level. It's not the single only risk factor, it's one of multiple risk factors, and we have to incorporate those in our decision making. Other factors may be even more important. It's true that, for example, neutering increases the risk of osteoarthritis, as I've already shown you. But if you have a greyhound, it's very unlikely that neutering that dog is going to dramatically increase the chances of them getting osteoarthritis because that's so rare in the breed to begin with. Whereas if you have a dog like a golden retriever or Labrador retriever, where that kind of disease is much more common, then the effect of neutering may be more significant. So other risk factors can swamp the influence of neutering on the health outcomes we're interested in. It's not the only thing we should be considering. The effect size is always greater when there's a pre-existing risk that's greater. So things that neutering is likely to make more common are particularly problematic when they're already quite common in the particular breed or sex that you're dealing with. The bottom line is that individual risk is inherently unpredictable. We will never know what's going to happen to one particular patient. So we have to live with that uncertainty. Another problem is that populations matter to us as veterinarians, but they don't always matter to our clients. And that brings me to the question of what do we actually say to our clients? I think it's important that we be open to changing our practices over time. And I think it's important to consider that sometimes not neutering is a reasonable option. And that may be less of a surprise to some of you, depending on where in the world you are. Here in the US, that's still considered a crazy idea that we might leave animals intact sometimes. So let's move on quickly to what we think of as the communication side of this. How do we talk to owners about it? I think the most important thing is to recognize, as I've already said, that uncertainty is unavoidable and we all hate it, but it's there, so we have to learn to deal with it. Our clients care only about their individual pet, but of course we care about the population and about the effects of neutering or not neutering on all animals everywhere. There's also lots of misinformation. These are just some examples of misinformation about neutering. The idea that it increases rates of deadly cancer tremendously and that veterinarians pay no attention to this and refuse to acknowledge it. Clearly that's untrue, but owners will come in with that perspective. The idea that mammary cancer, for example, only exists because of things that we do, because of our awful vaccines or our awful diets or our awful heartworm preventatives, or because we neuter. And this author says, well, in the wild, canines don't get mammary cancer. And that's probably true, probably because they die of malnutrition or infectious disease or trauma or other things first, right? So when we're talking to clients, I like to start with reassurance. I like to remind them that actually there is no single right answer, that the uncertainty doesn't just mean we don't know anything. It means that whatever we decide is not going to be the only factor that influences the outcome for their pet. And that in the bottom line, there's no wrong decision, and most of the time, most pets are going to thrive regardless of what choice we make. There are some better and worse choices for balancing the risks, but in general, there's no single right answer, right? I like to explain things in terms of there are certain conditions that may be more common with neutering. There are other conditions that may be less common. This is affected by a wide range of factors, including the breed, size of your dog, age, and all those things. And then for your individual pet, bring it back to what do I recommend for you and your individual pet? It's important, I think, to be clear with clients about what we think they should do. I do see a lot of particularly younger veterinarians who feel like they just provide neutral information of a factual nature and then stand back and let owners make decisions. And I don't think that's our role. I think our role is to definitely be advocates for our patients and to say, here's what I think is best. But we do have to be sensitive to the fact that our clients are going to come in with lots of concerns, lots of anxieties, and we want to make sure they know that we take that seriously, that we validate those, that we acknowledge them, that we understand the source of them, but we also recognize that there is a context, that there is information that can be helpful to them in making decisions in a more reliable way. So for what it's worth, and I'm not presenting this as the definitive answer in any way, but for what it's worth, what do I say to my clients? For male dogs, honestly, I believe at this point, the balance of the evidence suggests that the net effect of neutering on health is pretty neutral. There's not a compelling case to be made that neutering dramatically improves or reduces the health of male dogs overall. I do think there is, that means there is some reason to consider not neutering as a legitimate option, but you do have to be mindful of behavioral issues, of unintended reproduction. People will have additional responsibilities to take on. Personally, if I have larger breed dogs, I think there's sufficient evidence to recommend delaying neutering until they're fully grown. That seems to be less of an issue for smaller dogs, but in larger breed dogs, it seems to reduce the effect of neutering on neoplasia risk, on osteoarthritis risk, and other sorts of conditions. There's no ticking clock with male dogs. Nothing's going to change if we wait. So I think waiting is reasonable for larger dogs. I think it's less important for smaller dogs. Female dogs, I think there absolutely is a net benefit to neutering for female dogs, predominantly because of pyometra and mammary cancer, which are significantly reduced or prevented by the procedure. And so even though there are some potential risks that are increased, which vary with the breed of the dog, I think it's still appropriate to neuter all dogs, all female dogs. I do think that there is a case to be made for waiting in larger breed female dogs as well. The balance is a little tighter than it is for male dogs. There is a ticking clock in the sense that delaying neutering may increase some risks, for example, mammary cancer. I don't think the numbers that we have for that are very reliable. So I don't think we can say much quantitatively about how much. But in general, I do think it's reasonable to consider waiting for larger dogs. Now, if my clients choose not to neuter initially, I always remind them that you're probably going to end up doing it at some point, and you probably should, because the risks that come with that, pyometra, mammary cancer, continue to accumulate over time, and there is some benefit to neutering even later. I always feel bad for giving short shrift to cats, but the reality is we have a lot less evidence for cats than we do for dogs, which makes it harder to make evidence-based decisions. There are some medical issues. There are conditions that are more likely if cats are neutered early, some things like femoral head neck necrosis, for example. On balance, I think most people, and myself included, do still recommend relatively early neutering of both male and female cats, simply because there are a lot of things that happen to intact cats that owners are not going to be able to appreciate or manage much of the time. There are some resources which I think are really useful. The RCVS Knowledge Group has a fantastic collection of resources looking at all of the literature on all different aspects of neutering, and I encourage you to spend time with those and to think about, the nuances and the complexities here. In terms of communication, I keep talking about uncertainty. I think we need to be aware that uncertainty is not the death of confidence for our clients. There's some research showing that clients do not lose confidence in us if we express uncertainty or talk about the nuances. I think we have to be wary of what this author calls vetsplaining, the idea that we can simply dictate to clients what to do from our position. I think that's not effective and not appropriate. So I think our role is to acknowledge the uncertainty, to work that into our considerations and the decisions we make, and then to share our view with our clients about what's best for them to do, and then ultimately to acknowledge that they have the responsibility for making those decisions.